Welcome back to the discussion From Sea to Shining Sea, Connected Government at Work, sponsored by Avaya Government Solutions on Federal News Radio 1500 AM and federalnewsradio.com. My guest today is David Moss, Director of Federal Healthcare Solutions, and I'm your moderator, John Gilroy. The federal government is a leading healthcare provider, and few doubt there is room for improvement. From streamlining the admission and discharge processes to benefits management to enhancing privacy protections and trusted health information sharing. What are your perspectives on how today's collaboration and communications technologies can directly support better quality patient care?
Well, John, I think there are several issues related to healthcare, both in the federal and the commercial space. But one of the biggest issues that I think most clinical facilities are dealing with is a shortage of nurses and doctors. Add to that, nurses are spending less and less time as years go by with patients and more time with administrative work. Technology exists to solve a lot of the problems today. So if I use, for example, what I just talked about, there's a lot of technologies that could put nurses more in front of patients on a regular basis. And I can give you an example. Today, a nurse may take a vital from a patient. They take their blood pressure, they take their pulse, their temperature, and they find that something is slightly out of kilter, and they need to get a clinician involved. Typically, in most hospitals today, as strange as this may sound, the clinician staff is listed on a blackboard over the patient's right shoulder. So when the nurse looks over at that blackboard, looking for the clinician, he finds it hasn't been updated since 1972. And that's a very common thing that goes on today. So what happens is that nurse then goes back to a workspace, goes into an electronic health record system, opens the system, looks for who's the doctor that's on call, tries to find their phone number, and starts dialing to get a hold of them. This is a 10 to 15 to 20 minute to sometimes a half hour process just to get a doctor's advice that a temperature is up a couple of degrees. What do I do? That could all be electronically enveloped today, that vitals are taken automatically. Alarm systems go off. Information is provided to smartphone applications as to who the clinician on call is and whether they're even available to take a HIPAA-compliant message or a very secure call from the nurse in order to be able to resolve the issue very, very quickly without having all that administrative time in between. So there are a lot of examples. I use one as a poster child for the most part, but there's a lot of ways that efficiencies can be accessible and enhanced significantly by the use of technology.
Interesting that Avaya technology can actually improve quality patient care, which is the objective here.
Well, that's the goal, right? Yeah.
The whole idea, isn't it? Yeah. And most of these patients are in hospitals. And hospitals, both commercial and federal, report that it's hard to maintain profitability, and there are many areas of improvement required to allow for dollar savings while at the same time increasing patient satisfaction. So there's a balance there. You got to operate the hospital efficiently from a fiscal perspective. Same time, you got to keep the patients happy. Can you point to any examples where hospitals can use technologies for both economic and quality of care gains?
Well, I think I just did a couple of moments ago in terms of one, but I'll talk about a couple of others as well. But this is a topic that, we only have 6 minutes. This is a topic that could take 60 minutes or 60 hours to really fulfill. So we talked about allowing nurses to spend more time with patients and be able to use technology to that avail. Let's use another one that's even away from just nurses and doctors. Food services. Food is delivered to patients on a regular basis, but many times patients are not at their bed. They're rolled out to an x-ray room. They're rolled out to get an ultrasound or other procedure. The food service delivers the food. It sits there for 30 minutes and then is thrown away. There are hospitals that are reported to us as much as millions of dollars of food thrown away just because the food service did not know the patient was rolled out to go get an x-ray. And then they have to reserve that back a little bit later on. The patient's hungry when they get back to the room. It may take another 2 hours to get that food there, and the food is sometimes thrown away. And when you talk about millions of dollars of waste in a system, just in one hospital, and then you look at someone like the VA and manage that across the largest hospital system that there is in the world, it's millions to tens of millions to possibly hundreds of millions. There is technology again today that can make it very simple. When the bed is rolled out of the room, something as simple as an alarm goes to the food service that says John Doe cannot receive the food until the alarm system signals he's back, right? So there are a number of cost-saving environments that actually fit within this whole cost-saving, better efficiency, better service to the patient type thing. And they cover things like how to admit patients quicker, how to discharge patients much, much quicker, and they go through the whole hospital process and the whole workflow environment.
Last week, one of my radio guests showed me his Apple Watch. I keep thinking of Internet of Things and devices in the hospital. It seems kind of difficult to manage all those. So how can healthcare professionals harness the information from all these internet devices, especially in a hospital situation?
Well, it's interesting you mentioned the Apple Watch, because sitting in the lobby right before we got together today, I read something that Aetna has just announced, that they're going to start compensating employees and employers for wearing and monitoring their vitals. Now, that's scary on one part. Okay, we've got that. But it could be a scenario where something like a device like an Apple Watch lowers insurance rates and does things associated with that. But I'll be the first.
So that's the next best thing in healthcare IT, you think? Is that what it is, IoT, and managing them in a network?
I don't. Well, managing in a network has to happen, because there's got to be security put around it, and there's got to be administration put around it, and so on and so forth. But really what it comes down to is where we're going as a society in terms of being able to monitor and work with people no matter where they are. So I would be the first to tell you, I don't think Apple Watch today is a medical grade device. I'm not going to live and die whether someone's heart rate goes up or down based upon an Apple Watch. It may get there someday, but there are items that are what we would consider medical grade to do that. And one of the biggest advances within this environment is the ability to take patients and monitor high-risk patients on a 24-hour basis. For example, the ability to bring a patient and bring them out of the hospital while monitoring them at the same time.
I'd like to thank today's guests: Don Turner, Technology Lead Engineering Team; David Moss, Director of Federal Healthcare Solutions; Mitch Robinson, Senior Manager of Business Development. And I'm John Gilroy, Federal News Radio 1500 AM. For more on this discussion, visit federalnewsradio.com and search Avaya.
On behalf of Avaya Government Solutions, thank you for joining us. A link to the archive session will be sent to you shortly. If you request a training certificate, you will also receive an email with download instructions after the webinar. This concludes our discussion, and thank you very much.